All right, whether you injured your knee from trauma or some kind of injury, or your knee is just gradually getting more and more painful and swelling, whatever it may be, this video is going to help you determine if you go in to see a doctor or not.
Right.
Bob and Brad, the two most famous physical therapists on the internet.
All right, Bob, I've boiled this down to 7 different categories.
Gotcha.
I think it covers 99.
Your favorite number.
Yep, 99.4% of the problems will be covered in these 7. So the first one, if you hurt your knee or it's just getting so bad that when you walk, when you put weight on it, it's
Right.
painful and you're limping.
You look like Dr. House.
Right. And let's say you are not getting better. If you're limping one day and the next day
Right,
it's better, that's
right.
one
Or
thing.
it
But
feels like it's getting better.
yeah, if it's getting worse day by day, or if it's very painful, you got to go in and get it checked out. You need X-rays.
And use a walker or a cane or a crutch.
Yeah.
Until you go in and see the
Yeah,
doctor.
don't tough it out. You
Right.
know, I might do that.
Right.
I ain't gonna use no cane, but yeah, use something. Stay safe so you don't fall or irritate it more. Number 2, Bob, swelling. You know, it's not unusual that you injure your knee or it swells, and
Right.
that doesn't mean you should go into the doctor. But if you've got a knee that's swelling where it's just the dimples are swelled, that's one thing. But when
Right.
you've got it, so it looks like you've doubled the size of the girth, looks like a watermelon, then you should get in.
Right.
Get in, get it checked out. Or if the swelling is getting worse day to day, maybe you did it and it is like that watermelon, but in a few hours or the next day,
It's a lot better.
it's a lot better. That's okay.
I want to say that's too bad. If you have a lot of bruising in the muscle around it,
Yep.
that might be a sign too. They might have tore something.
Right. Yeah. So you got we call it ecchymosis, and
Right.
and sometimes that doesn't show up until the next day.
Yeah,
all of a
exactly.
sudden, it's all black and blue in that purplish color.
Right.
Yeah. So those are all things that means it's bleeding inside. Get to the
Right.
doctor in those circumstances.
Number 3.
Number 3. Yeah, we're talking about. Do you feel unstable?
Right.
So you're walking there, it's not painful
Just doesn't
particularly.
feel right.
Yeah, and
Gives way.
these are 2 things that are commonly happen. Either that extends back this way and it's like,
Right.
oh,
Right.
and then puts you at risk for fall, Bob,
Yeah.
and then you don't want to compound it. The other thing is the quads may give out because of the pain,
Right.
and they'll make you go down like this.
Yeah, exactly.
And it'll come just like that sometimes.
Right.
And then down you go.
What a surprise.
Yeah. So if you got buckling or hyperextension that I tried to demonstrate, make sure you get in because it's going to lead to, particularly with elderly people that may not be able to catch themselves and really have a problem.
Number 4.
Number 4, we're going to talk about the kneecap. Put your knees next to each other. They should look about the same.
You can actually find the edges of them
Yep.
and see where they're at, how they line up.
Right. If you got one kneecap that is over a
Way
half
over.
inch compared to one, and usually they do go to the outside direction.
right.
And then when you bend it, it's painful associated with that. You should get in. I mean, sometimes it looks good like this, and then you do a range of motion, and then it pops
Right.
over one way or another, and you feel the clunk, and it's painful. Get in, get it checked out.
Yeah. Number 5.
Number 5, popping, grinding, crepitus, all these things that something's going on in that knee.
Right.
And-
I think that's fine, but if it is associated with pain, get in.
Right. I mean, I've heard people's knees crackle and pop,
Right.
so you can hear it across the room, and they feel
Rice Krispies.
yeah, and they feel no pain,
Right.
and I don't get excited about
It's
it.
been going on for years.
Right. But all of a sudden, you get pain, particularly sharp pain associated with that. You should go in, get it checked out, because something
It's
needs to
not
be
right.
Right. It needs to be
Something
looked
is
at.
amiss.
Don't be stubborn.
Number 6,
Number
Brad.
6, what our therapists are good for is range of motion. Now you can check your range of motion and simply, let's say this is the injured knee. Look at your good knee first. Can you straighten it fully? Can you bend it fully? The answer will probably be yes. So look at your sore knee, and if you can straighten it right to here, well, that's not fully straight.
It might be real subtle.
You're right.
A lack
Exactly.
of motion.
Yep. So check it and compare to one leg to the other. They should be
Might
even.
have put it on stools.
Here. I don't want you to overexert yourself, Bob. Well,
Right.
you got a stool. It doesn't look pretty, but
Now show one that's bent. Brad.
yeah. let's say this one's a normal one and this one doesn't go down. It's like, oh, and then you push it and it kind of hurts too. That's
And
not
the same
good.
with bending it. You can actually feel it. It doesn't feel right.
Yep. You get in. If this foot, the heel goes to your butt, well, this one probably should too, unless you had a previous injury. But you get in here, So check both ways, extension, flexion. If it's painful with it and it's not getting any better
not
by
getting better.
Yep, by the next day, get in, get
Yeah.
it checked out.
All right, number 7, or sieben, as the Germans call it.
Oh, really?
Yeah.
I'll be darned. Well, anyway, 7. It's a good number, and we're going to stick with it. The last one, and it's if your knee tends to lock up.
Right.
I can give you a little example of this. I had a woman come in. She was about 40 years old, and she says, when I bend my knee, it locks, but then if I kind of wiggle it around,
Jiggle around.
yeah, and then it's okay.
Right.
And she said, if I go up and down steps, it's more common. So I had her go up and down the steps, and it locked, and it was painful, and she did this, and she...
Off she went.
Yeah, so you know what I did?
What'd you?
I called the orthopedic doctor, and she got an appointment, and she left my office.
Sure.
Because
Send her out the door.
yeah, I knew it was a
Right.
problem. She had to have the
Right.
doctor look at it. It was almost certainly her meniscus.
Right. Cartilage is floating around. It gets stuck.
Yep. And it's very difficult to treat that with therapy. Get it assessed and see if a simple surgery to debride it or pull the floater out
Right.
and fix things quickly.
There we go. That's all 7, Brad.
Good luck with your knees, because if you don't got your knees, it's going to be hard to run or walk. How'd that sound?
Or kick footballs.